A new report from the Canadian Institute for Health Information shows just how much the pandemic impacted the supply and distribution of healthcare workers across the country, along with physician payments and utilization. The data shows that in 2021, average overtime hours among healthcare workers were the highest they have been in over a decade, with more than 21% of employees in health occupations working overtime, averaging about 8 hours per week of paid overtime and nearly 6 hours a week of unpaid overtime. The highest proportion of extra hours worked reported by job category included 45% of paramedics, 34% of salaried family doctors, and 31% of respiratory therapists. Due in large part to COVID-19 related public health measures, between 2020 and 2021, physicians provided nearly 8% fewer health services in Canada, including about a 7% decrease for those in family medicine. There was also a drop in the number of working primary care physicians, registered nurses, and licensed practical nurses, while nurse practitioners became one of the fastest growing group of healthcare professionals. The data comes as several hospitals across the country report overwhelming cases of flu and RSV that are compounding pre-existing workplace stresses and labor shortages.